This approval means that thousands of women diagnosed with early stage breast cancer will have access to a medication that could help prevent their cancer from coming back. As we now mark Breast Cancer Awareness Month this October, I want to bring in Dr. Susanna Hills. She is a surgeon and assistant professor at Columbia University Medical Center and a survivor yourself of stage 3 breast cancer.
That's right.
First of all, welcome back to the Rush Hour. Thank you for coming in.
Thanks.
And I want to talk about your diagnosis and a little bit about what this means to you in just a second, but talk about this Kisqali approval now and what this means to many women.
Yeah, it's really, really exciting. It was a drug that was previously used specifically for metastatic or incurable breast cancer. Now it is shown to reduce the rates of recurrence over 3 years after diagnosis for stage 2 and stage 3 breast cancer by 25%. So it's really very exciting, especially for women with cancers like I had, which stage 3 or stage 2.
Yeah, and talk about what this means to a survivor like you, knowing that this is now going to be more readily available.
Yes, I mean, one of the things about surviving any cancer is that, especially if you've had a diagnosis where there's a chance of it spreading, like a stage 3 diagnosis or a stage 2 diagnosis, you get through treatment, there's always a lingering chance that down the road it could come back. There's still that worry hanging over your head, that concern. And to reduce the rate of recurrence by 25%, to take away some of that burden of concern for a significant group of women is just, hugely reassuring and really will be a huge benefit to survival for women.
How does the drug work?
It disrupts the activity of a protein, kinase protein. And that protein is responsible for the growth and division and spread of tumor cells. So the drug stops that protein from working, and it can stop the spread and growth of the tumor itself.
So mammogram guidelines changed this year. Talk a little bit about the significance of that. What is the current recommendation? These recommendations have changed often. So I want you to just address where the recommendations stand right now and what you as a doctor think is best practices.
Yes, well, they did create a really big shift. The recommendation used to be to start getting your annual screening at 50 years old. Now they've changed it to 40 years of age, so significantly younger. And that's a reflection, really, of the fact that the face of breast cancer is changing. We're seeing more and more younger women being diagnosed with breast cancer. We're picking it up earlier. It's affecting younger women more. And so we're going to catch this disease earlier and we'll be able to help more women survive. But it also means we're going to catch it at a time when women may still be in their fertile years. They may be raising a family. So it's going to shift some of the ways we manage breast cancer for a lot of women detected earlier.
Do you know, are you familiar with the percentage of women who have cancer have breast cancer that was diagnosed through a mammogram versus a self-detection, finding a lump on your breast?
It's the most common way to find breast cancer, getting a mammogram is. So breast self-exams, very, very important, but the majority, especially of early stage treatable breast cancers, are found on a routine screening mammogram.
And there's a huge segment of the population who is concerned about getting too many mammograms because of the radiation exposure. What do you say to that?
Right, yes, and certainly the recommendation for an annual screening is considering what the risk would be, and generally speaking, it's considered to be extremely safe. Getting an annual mammogram, we get a certain amount of radiation just from being on the planet in a year. Getting a mammogram is really similar to that, what you'd get just from being on planet Earth for a year. So it's really considered to be a minimal exposure for a tremendous benefit, potentially.
So there was that change this year in terms of the recommendation of getting your mammograms a decade earlier. There was also this year really the explosion of AI in all facets of our life, including analyzing mammograms. Talk about how that might impact detection.
Yeah, it's really, AI is particularly exciting in diagnostics and imaging diagnostics, like mammograms, CT scans, all of that. It has tremendous potential to instantaneously look at millions of scans from prior women, millions of women's risk factors, and really assess for a particular patient what chance do they have of having a breast cancer. What they can compare their mammogram with millions of other mammograms and really accurately detect whether or not that looks like millions of other scans with breast cancer. Much more accurately, really, than a medical professional probably could. So I think our hope for AI in diagnostics is really high.
Yeah, it's fascinating. It's one area where everybody seems to be in accordance that AI is incredibly potentially helpful in changing it. Dr. Susanna Hills, thank you so much. Really appreciate your coming on.